Hello, I'm Dr. Richard Barron, President and CEO of the American Board of Internal Medicine and the ABIM Foundation. And I'm here today to talk to you about the Choosing Wisely campaign, an initiative of the ABIM Foundation. The United States is on all the wrong lists in all the wrong places. We top the world for spending, but we are very low in overall performance. You might think that the more you spend, the higher the quality, but it doesn't work out that way in this country. The Commonwealth Fund has produced reports comparing our spending to spending in other countries and comparing our health outcomes to health outcomes in other countries. And the bottom line is we spend more and we get less for what we spend. And the painful thing is, as you can see on this slide, the worst part is a lot of what we spend is waste. This is actually a slide Don Berwick put together, and it came from the environmental movement, of all places. His wife is big in environmental work. And she looked at a graph of carbon emissions and what would happen in the world if we didn't do anything to change carbon emissions. And you get the curve that's on the top if you don't change anything. But the article that influenced her looked at different components of what was contributing to carbon emissions. What if we closed all the coal-fired power plants? What if we moved away from vehicles? What if we used more efficient appliances? Each of these things would contribute something, but no one thing would make carbon emissions stop. And that's where we are in healthcare. The top of this curve is what happens to healthcare expenses if nothing changes. But the wedges are the different components that are contributing to the waste. The Institute of Medicine has estimated that that waste could be as much as 30%. If we define waste as services done for patients that don't benefit patients, as much as 30% of what we're spending could be waste. Now, fraud and abuse has no constituency. That's the bottom piece. And we all know as physicians that billing is hopelessly complicated and costs a lot of money for us to generate bills and get paid. But it's the top part of the wedges here that I want to direct your attention to. The parts that really deal with things that we do as physicians in healthcare. Overtreatment primarily will be the focus of the rest of this presentation. What drives that? Why do we have this problem? How did we get lost? Well, as you can see on the next slide, there are a bunch of assumptions that we may have in this country that seem to move us in this direction. We start out with the idea that more is better. Americans just seem to believe more is better, but we know that's not true. We also know that it isn't taught in medical school or residency training, or hasn't been reliably taught, that we should be aware of resources, that we should think about the different comparative effectiveness research, the different impact of different services that we might offer, and how much difference they really make. A lot of people think the fee-for-service system is core to the problem. Let's face it, as physicians practicing in the US, the more we do, the more we get paid. That's not the reason we do it, but it is an economic reality, and given the choice between doing something and not doing something generates revenue, not doing something doesn't. So fee-for-service is a powerful driver of the decision to do things. We don't consider comparative effective research most of the time when we're making these decisions. And the fact is we don't have a transparent system of pricing, so doctors often don't even know the cost of different procedures. We don't know the cost of different drugs. We don't know what hospital A charges for something compared to what hospital B charges. And it turns out there are differences. But when you actually ask physicians what we think, what they think about overuse, well, there's a bunch of things you learn, as you see on this slide. First of all, 72% of doctors believe that they are doing unnecessary procedures, ordering unnecessary tests, at least once a week. Think about that. 3 out of 4 of us believe that on an average of once a week, at least once a week, we're doing a procedure we don't think adds much. 3 out of 4 of us, 73%, believe this is a very serious problem, which it certainly is. 2/3 of us feel that it is our responsibility to avoid overuse, that physicians have a role in addressing this problem. And more than half, 58%, believe that doctors are actually in the best position to address the issue of overuse. And of course, keep in mind, if we don't do it, the insurance companies will, or the government will, and they won't do it as well. So if physicians feel like we're responsible for part of the problem of overuse, and if we feel like we're engaged in it, how do we respond? Well, that's what I'm here to talk to you about today, the Choosing Wisely campaign from the American Board of Internal Medicine Foundation. It's an initiative designed to help physicians and patients confront this problem through being able to talk about it, and talk about it in a way supported by medical evidence. Let's face it, payment systems are changing, patients are bearing more of the cost, they're aware that increasingly as doctors we may be operating in arrangements where we have different financial incentives than the old ones, a certain amount of skepticism. Choosing Wisely is designed to allow doctors and patients to have conversations that support patients' abilities to make smart, effective care decisions that are what they want. Choosing Wisely arises from the Physician Charter, something created by the American Board of Internal Medicine Foundation, the American College of Physicians Foundation, the European Federation of Internal Medicine, created in 2001, and hundreds of organizations have signed up. And it's a charter on professionalism for the 21st century, and it identifies three fundamental principles: the primacy of patient welfare, patient autonomy, but also social justice. And the charter explicitly called out in 2001 that a just distribution of finite resources was a core responsibility that physicians face. We've been doing that for a long time. We've been managing some number of ICU beds and trying to figure out who needed to be in them and who didn't. We've been managing blood bank supplies. A bunch of different decisions that we've been making as doctors, explicitly called out in the charter, is a responsibility to manage resources effectively. And once again, society spends resources on healthcare. Those are resources we can't spend on education. Those are resources we can't spend on infrastructure or transportation or a lot of things we might want to spend money on. So the ABIM Foundation gave a grant to the National Physicians Alliance. And as you can see in the next slide, what the NPA did with that was to create a top 5 list in primary care. And it was kind of like a guideline development process. And you're all familiar with that. You get experts together around a table to talk about what's the best way to do something. This was experts around the table saying, are there things we're doing too much of in primary care? Could we come up with a top 5 list? And the answer is, we could. And then Howard Brody wrote a piece in the New England Journal of Medicine talking about medicine's responsibility under healthcare reform. With the early experience with the National Physicians Alliance focused on primary care, the ABIM Foundation came up with a framework, as you can see in this slide, that created expectations for physician specialty societies to create top 5 lists of their own. And there were 4 requirements put out in front of the specialty societies. The first one was that the things on your list have to be controlled by your specialty. You don't get to write a list about what a bunch of other people do. You need to write a list about things that you in your own specialty are doing. They need to be things that are either used a lot or are costly. So we wanted high impact things on that list. It needs to be evidence-based, that you need to be able, if you're putting something on the list, to be able to cite literature to explain why it's on the list. And you need to be transparent about the process you use to develop the list. Those were the 4 expectations, the 4 requirements that ABIM Foundation put in front of medical subspecialty societies and invited them to come and work with us on developing top 5 lists. And the response, as you can see in the next slide, was astonishing. First, we had 9 partners who began in 2012. There were a bunch of people who said they wouldn't do it, couldn't do it, but 9 courageous societies stepped out. Well, when people saw what happened and how much energy and attention that got, a group of others came on the next year. We had another 23 joined. And then the following year, in 2013-14, more and more people came on. We have more than 60 professional societies now engaged. But as I said earlier, this is about a conversation between patients and doctors. And we realized that we needed a consumer partner to help us with this conversation. And in the next slide, you can see that we generated a long list of consumer partners, but the basis of the consumer partnership is with Consumer Reports help. And they help translate the 5 things lists into formats that patients could understand, and their logo's on it too, so these are credible, believable resources that patients can look at and know that they came from a subspecialty society with the imprimatur of Consumer Reports on them as well. And the Robert Wood Johnson Foundation was so impressed that they gave us some additional money to partner with 21 state and regional actors to advance Choosing Wisely. The founding partners, as you can see on the next slide in the consumer group, are listed here, but we also got national partners, subspecialty societies, and the regional partners all together. So you can see that this is an initiative that has generated a tremendous amount of momentum. People have really gotten excited. So what's on these lists? Well, the next slide shows this is the kind of document that Consumer Reports has produced, and by the way, these are available on our website and they're not copyrighted. You can incorporate them into your practice if you want to. This is a top 5 list, and what's on the list? Well, you can see different services. Don't do imaging for uncomplicated low back pain. Most people are going to get better whether we image them or not. There are other things on the list. Don't routinely prescribe antibiotics for coughs and colds. We know that antibiotics are used for sinusitis inappropriately. Increasingly, we're all worried about a variety of complications from routine antibiotic use, and we want to be sure we avoid those complications. So once we had these vehicles together, once we had this content together with Consumer Reports and the societies, as you can see on the next slide, this really took off. There was massive coverage in the lay media, the Wall Street Journal, the New York Times, Forbes, USA Today, TV, extensive media coverage, which continues to this day. Lots of people wanted to get the word out, and you may well find in your patient population that they've heard of this, they're familiar with it. So a little bit, the news was, it had a kind of man bites dog quality to it. It was, wait a minute, here are specialty societies stepping up and talking about things we shouldn't be doing, we don't need to do. And that was very, very newsworthy because physicians ourselves, through our societies, were taking leadership in a critical issue facing the country. Something that really might help us move in both directions on that list, go down in cost, go up in quality, as we need to do as a country. So we get things like the New York Times calling out medical procedures to avoid in the elderly, and talking about the role of professional societies in making this work. We got a ton of coverage in professional media. The next slide shows a JAMA article talking about the value of these lists. Again, they're not everything, but they focus attention on some areas that is manageable. You have resources to support conversations with your patients as you go through this kind of work. And a lot of health systems then got on board and said, this can really help us engage our doctors and communicate with the patients we serve about areas that we should be working on. And as you can see in the next slide, the Hutchinson Cancer Center started looking at the ASCO, the American Society of Clinical Oncology, Choosing Wisely recommendations. They looked across 18 different practices in the Pacific Northwest, and they started comparing and realized that there was a lot of variation in how closely people were following the recommendations in the Choosing Wisely list, and organized an effort to promote Choosing Wisely choices within a group of different offices. University of California, San Francisco has been very active. Cedars-Sinai put some of the Choosing Wisely recommendations into their electronic health record, into the Epic recommendations, into the Epic health record. And so physicians are getting alerts when they're trying to order tests that Choosing Wisely might say, wait, you might want to talk about this before you did this. And Kaiser Permanente has done this too. And it's been a really interesting partnership as we move as a delivery system toward high-value care. The people leading some of the delivery systems really value the opportunity to engage their physicians in a professionally valid way, because this isn't about rationing, this isn't about withholding care, this isn't about financial performance on an accountable care contract. This is about giving patients what they need, not more, not more. Giving them what they need, having conversations with them about where the benefit really will be. We believe Choosing Wisely has reached, as you'll see on the next slide, 96 million patients. 96 million patients. That's 1/3 of all patients in the country. Teach future physicians. As you can see on the next slide, there's a lot of residency programs that have adopted Choosing Wisely. Folks at Hopkins looked at the way they were ordering troponins on patients who were admitted, and they weren't following the do one troponin. If it's negative and low risk, stop. When they implemented that, they saved millions of dollars for their hospital. Program, as the next slide shows, we've been able to do some regional transformation initiatives. We've had entire states involved in Choosing Wisely. We've had medical societies involved in Choosing Wisely. The Texas Medical Association has been a huge champion of Choosing Wisely and disseminated Choosing Wisely materials to their members in Texas. So I have 5 questions for you that you can see on the next slide. Have you ever received unnecessary care? How can we help you have these conversations with your patients? How can we reach more patients with the Choosing Wisely materials? How do we change the more care equals better care fallacy? That's a mindset that simply isn't true. How do we help doctors and patients move away from that? What does Choosing Wisely mean to you? I'd like you to think about all those things as you think about ways to bring this into your practice. None of us go to work to do more for patients than they need. None of us go to work to harm our patients. Doing unnecessary tests risks harm. That's a core message of this program. More is not only not always better, sometimes it's worse. Sometimes it has us doing things that expose patients to risk, expose patients to additional testing, expose patients to additional procedures, and if it doesn't benefit them, that's immoral. So I'd like you to think about those questions and think about how to bring this into your practice. And on the next slide, you can see where to go for more information. You can also see my Twitter handle if you want to follow me on Twitter. I often tweet about Choosing Wisely because it's showing up in so many different spaces in healthcare. Just this week, there was a Harvard Business Review article about it. There was a Law Review article about it. It really is something that is moving and engaging a lot of people. And if you go to the website, the ABIM Foundation website shown here, you can access the materials and you can bring them into your own practice. We hope that you will do that. Thanks for your time today. Appreciate all of the care you provide for your patients and hope that Choosing Wisely helps you have difficult conversations with patients and avoid harm and avoid waste, which I know is something all of you care about. Thanks for your time today.